Hello, my name is Sophie. I am a GP and I am Director of Medical Education at UCL Medical School for primary care and community, and I'm just going to take a couple of minutes just to tell you about some opportunities to get involved in teaching for UCL Medical School. We have campus-based teaching and we have practice-based teaching, both short-term and long-term placements ranging from a day to over 6 weeks or even a year of involvement. We're really keen to outreach into the community to work with you as tutors and also to involve patients in active learning within the practice as well as within our department in helping us to shape and reform our curriculum over time.
I'm a GP. I work in two practices actually because I'm a locum GP. Well, I teach at my Watford practice, which is a practice for the homeless. So it's a GP surgery for the homeless called Meadowell Clinic, and that's in Watford, and that's where we have the students coming to learn psychiatry. Well, I love teaching. I think I was sort of born to teach, being the firstborn, because in our culture, if you're first, you teach the rest.
I think teaching is so stimulating. That's the first thing. I mean, it's for keeping yourself up to date, being very accurate in things you teach, because ultimately these medical students are going to treat me when I'm a pensioner, and I want them to have the best teaching. And there's an awful lot to teach, not just simple communication skills, but clinical skills, examination skills, and dealing with people. It's not the easiest thing in the world.
For UCL, I do a couple of roles. My main role is teaching the MIC course, the Medicine in the Community course. So we have fourth year students who are in their first clinical year, and they come for a full day 10 times in the year, which is lovely because you get to know them and you really see their progression, because they really start with a very low baseline of knowledge because it's the beginning of their clinical studies. And throughout the year, they really become proficient and excited about clinical medicine. And by the end of the year, when they're preparing for their OSCEs, they're like fully fledged. They've got their core skills, which is fantastic, and they develop in their confidence.
Obviously, students do a lot of learning from textbooks, but what they actually see in practice is how it actually is. And you can't really learn any of that from the textbook. They can see professionalism, they can see problem solving, they can see the journey, the whole patient journey, and how a doctor can actually make a difference in the patient's experience.
When we have the medical students, what my colleagues have come, so this is what they've said to me without me asking. They said we learn so much, we benefit from having the students in our practice because the medical students clerk the patients in such detail that we learn more about our patients than we didn't have, than we didn't know before, because we don't have that much time with them. But when the medical students come, we create a longer time for them to clerk. And so we find out things about our patients' lives, which is very important, particularly in psychiatry.
My patients are well trained. They know that when I'm teaching, I'm going to take a little bit longer. And they enjoy that because then they get more time with me and also with the students. We get to explore their symptoms a little bit more as well, which the patients thoroughly enjoy.
My advice is that you need to start encouraging patients when you see them in the clinic, all right, with all sorts of chronic diseases or not so chronic diseases. Encourage them and start setting up a database on an Excel spreadsheet for different conditions: respiratory, cardiac, musculoskeletal, neurological. Have a list, all right, and then rotate around the patients. And those patients who are keen, encourage them. And when I teach, I have filtered coffee, I bring biscuits, so they think they're valued.
If I was going to give any advice to a new GP tutor, what I think, one is perhaps it's worth going on a course. So I did the Introduction to Teaching in Primary Care course. That really, really helped because it helped to put aside some of the fears that you might have about teaching in small groups particularly, because it feels like there's a lot of scrutiny. You've learned how to practice and you do things in your own way over a certain period of time, and then you've got to relearn the medical student way of doing things. And also to design your teaching sessions to make sure they are, that it captures their attention. So that was probably the most helpful thing.
It's different to everyday clinical medicine. If to teach something, you have to learn it yourself, and I feel really confident in those topics. Often you learn a lot from the students themselves, and there's a certain energy you feel at the end of the day after teaching that you feel you've made a difference.
I would encourage anyone to get into teaching. I think it's a really good way to do something different rather than just seeing patients, and to inspire and encourage the future generation as well. I leave my sessions feeling really motivated, enthusiastic to do my afternoon clinic, which I definitely don't feel after a morning surgery. And the feedback I've got from the students has been really positive so far, but also they're going to help me shape and change how I do the teaching in the future.